Hi, I'm Craig Kuhns. I'm a spine and scoliosis surgeon at St. David's. My focus is really on complex cervical and scoliosis. Scoliosis is a curvature of the spine in a right to left plane. So if you look at a patient from the front, it would be where the curve of their spine is from right to left or left to right. The spine is made up of bones called vertebrae, which are stacked up on top of each other. The vertebrae protect a bundle of nerve fibers called the spinal cord. It runs through an opening in the center of each vertebra. The main sections of the spine are the cervical, thoracic, and lumbar regions. Looking at it from the side, the spine normally has three curves: a C-shaped curve in the cervical spine, a reverse C-shaped curve in the thoracic spine, and another C in the lumbar spine. Viewed from behind, the spine should appear to be completely straight up and down. Scoliosis is a condition where the spine has an abnormal side-to-side curve. Most cases of scoliosis have no known cause. In some cases, scoliosis may be present at birth. In other cases, it may occur over time. The most common cause in adults is asymmetric degeneration of the disc, causing the spine to be tilted to one side or the other. Other causes may include cerebral palsy, paralysis, muscular dystrophy, osteoporosis, or even spinal fractures. During childhood, the spinal curve usually becomes worse during periods of rapid growth. If the curve becomes severe, it can cause problems with posture, walking, and back pain. It can also cause the internal organs to be cramped for space, causing hard breathing and even digestion problems. Scoliosis is often treated with a brace to stop the curve from getting worse in the pediatric population. Doctors will measure the spinal cord over time to see if the brace is working. For an adolescent, a surgical procedure may be necessary if the brace isn't working or if the brace is not an option. For an adult with scoliosis, a surgical procedure may be necessary if they are experiencing numbness or weakness in their legs, or if they have progressively worsening back pain that does not improve with non-surgical treatments. The most common surgical procedure to repair scoliosis is called a posterior spinal fusion with instrumentation and bone grafting. To begin, the surgeon will make an opening over the area of the curve in the spine. The surfaces of the vertebra will be roughened up to help stimulate the bones to heal together. The surgeon will place screws, hooks, and wires into the vertebra. Rods will be placed alongside the vertebra and attached to the screws, hooks, or wires in order to straighten the spine. The surgeon may remove small pieces of bone from the ribs or hip bone to use as bone grafts. Other times, the surgeon may choose to use donor bone from a bone bank for grafting. The spine does take a while to heal. Bones don't heal overnight, and so it's a process of 3 to 6 months to get the bones to heal solidly. I tell people don't bend, lift, or twist for 3 months, because if they bend and lift too early, they're going to be wiggling those screws loose, and they may not wiggle them loose right away, but that may be over time something you don't want to take a chance with. So we try to hold it still and let the bone heal as the biology takes place.